Rise and shine. Starting off your day with good vibes and great music.
The greatest hits.
This is The Morning Fix with Tabby Minor
On Radio 44.
Okay, it is 4 minutes after 8 in the morning. We're into the second hour of The Morning Fix on Radio 44. Your music, your life. You're on with me, Tabby. Yes, today we chat biomechanics. I really didn't know what that was. I mean, I was a bit I was like, what are you talking about? With Dr. Abbie Najjarine. He is in studio. You will be hearing from him in a bit. And I know you're wondering, Podia, what? He does what? Hang in there, okay? We will be learning a lot together because we will be talking foot, ankle, knee, hip, and back conditions and how to manage them. If you're streaming us live from anywhere around the world, it's radio44.co.ke. Thank you for being here with us on The Morning Fix. Right now, we're starting off the hour with Shweta Pandit coming through for you. All right, in about a few minutes, in about 10 minutes, we have a chat about the state of your feet, your ankles, your knees, your hips. Yes, you name it. It is all happening here on The Morning Fix at 5 minutes after 8. Good morning. All right, it is Mika Singh, Neha Kakar Badshah, 13 minutes after 8 in the morning on The Morning Fix with me, Tabby. And I am joined in studio with Dr. He is Dr. Abbie Najjarine. He has over 30 years of practice. Is it since 1990?
Yes.
Since 1990. I was not born in 1990.
Wow.
It's absolutely insane. And of course, he's also based in Sydney, Australia, but he travels around the world just to be able to teach doctors what to do right in terms of foot, knee, ankle, hip. Did I leave something out?
I'm back.
Right? So what is that title? Biomechanics, what is...
So
is that for me a bit?
So I'm a podiatrist.
Yes.
I was trained as a podiatrist. I wanted to have interest in biomechanics because of my problems. I was grow up with a lot of pain and discomfort when I was growing up. I used to trip over a lot. I used to fall over, and I had pains from about 4 years of age to 7. I had a lot of pain. I remember I had a lot of pain. But every doctor I went to said it was growing pains. Don't worry, he'll grow out of it. By the time he'll be 7 to 10, legs will straighten up. Yes, my legs straightened up. I was pigeon-toed in the left foot, out-toed in the right foot. And I was falling over a lot. So my mum was concerned. But everywhere I went, doctors say, don't worry, he'll grow out of it. They made my mum feel like a fool sometimes. They say, look, you're just overprotecting parent. So by the time I got to the age of 10, I was walking straight, but the pain was so bad at night.
So it didn't actually go away?
No, and it got worse and worse. And playing soccer or playing football, well, I kept telling myself at that age, why am I the only one with these pains, no one else? Why everyone? And I was too embarrassed to say that was pain, so I gave up. And everywhere I went, don't worry, he'll grow out of it. Don't worry, he'll grow out of it. By the time I was 19, the pain just got worse. Now, the doctor kept telling my mother, your son, an attention-seeking child.
That's over 10 years of pain.
So he said, he's a sport brat, stop spoiling him. And that, literally, I nearly jumped over the table and nearly hit it because my mum had Crohn's disease, and my father had injury at work. So my sister and I were the cleaners of the house. We washed the dishes, wash the clothes, at the same time go to school and prepare my parents. Like, we were looking after them as carers. But then telling us that I was a sport brat, that was quite difficult to accept. But my mum never gave up on me. And she kept saying, don't worry, there'll be an answer for your situation. Then suddenly I was treated by this guy who came from Canada who was lecturing in Australia, and he was a podiatrist. But his interest was biomechanics at the time. Simple, he said, it's all coming from your feet. You've got one bone on your left is twisted in. So he placed my knee straight and my foot was pointing in. And my other knee on the right was straight and my foot was pointing out. And he goes, and my mother said, that's how he used to walk. He says, well, he hasn't corrected, he compensated for it. But all the doctors said he was correct. He actually counteracted the problem. The body compensated. In the words I remember, he said, to my mother, if you carry a heavy bag on one side, do you fall over to that direction or does your body straighten up? She doesn't know the body straightens up. She goes, exactly. The muscles on the opposite side will compensate for that weight. And that's what his body has done, has compensated through the hip area to counteract the problem. But his knees now facing the opposite direction. His feet might be straight, but his knees going nowhere. So that's why he's having leg pains, which are muscles which are not functioning in the right direction. So when a physio or a chiro or a doctor says, oh, your muscles are tight, now I say, why is the muscle tight? If your muscle's weak, well, why is that muscle weak? But the fact we forget that we walk on hard surfaces now. This is not a natural ground. In the old days, we used to run on grass and sand and different terrains and different surfaces. We don't do that anymore. We see a pavement, we walk on the pavement, we don't walk on the grass anymore. So hard ground, we've got gravity and ground reaction force. Two forces acting on our body. These two forces, our feet carry our foundation of our body. So if the feet collapse in, and when people say they have flat-footed, the foot is just not flatted, it is tilting inwards over the arch and leaning onto the ground.
Because
there's gravity.
Yeah, the surface.
Yeah. So in Australia, I wrote my book on the book I wrote in the last one. I wrote about this athlete in 1961 in the Olympics who won the gold medal barefoot from Africa. And
many of African athletes come from that background.
Why?
Yeah.
Because they trained on natural ground and different surfaces. You know, when I was involved in the Barcelona Olympics or the Atlanta Olympics, even up to Sydney Olympics, these were, I was looking at athletes saying, why are they physiques? Why their physique is so good? Because they trained on natural ground and different surfaces. I went to Fiji with my children, and the guys in Fiji were strong, and I kept telling them, we were going to the waterfall, for example, and we had to walk on pebbles. All the Westerners struggled to walk on rocks. Well, they walked on as if it was a pavement to them. But I wanted to know what gym they went to and how they're able to do that. And they said, our gym is our natural environment that we live in. We walk on different terrains and different surfaces. So hard ground has significantly changed our anatomical structure. So if you're looking at a building and you see a crack in the walls in the building, we instantly, we know that it's the foundation.
Yeah.
But most of us do what? We fix up the crack in the wall. And that crack keeps coming back. That's the symptoms of people pain.
You know, because, well, people experience pain, and I think we were talking about this off air, and we were saying, you know, pain has been normalized in our day-to-day, and it's very easy to say, okay, yeah, just, you know, it will ease off, right? And I think you just answered the fact that what is the root cause of such issues for some people, but then would you also be able to explain or tell us what is the chain reaction in the body generally once you have, you know, situations like what you had when you were younger?
So a lot of people are suffering, they wake up in the morning, they suddenly have no pain, suddenly they get up in the morning and they hobble around, they can't walk. They've got heel pain for the next 5-6 minutes, and it disappears. They ignore it. They think, oh, it'll go away. That fascia, that tight band of tissue that holds the foot up like a bow and arrow, like a bow, is just torn away from the attachment because we're walking on high ground every day. And they could have taken exercises up, or they've been walking to work every day rather than driving a car. So the activity might have changed. Now they've increased the forces on the feet, or it's taken time to develop that. So that stretching of that fascia underneath the arch is ripped the fascia away from the attachment of the heel. People call it muscle, but it's actually a very tight band that hold that arch up, and that's torn away. That's called inflammation, or itis is inflammation. So plantar fasciitis means the bottom of the foot, fascia is the tight band of tissue underneath the foot, and itis means inflammation of that fascia, the fascia underneath the foot, but it doesn't tell you what the cause of it is.
True.
It's only telling you that if you come in to a doctor and say, I've got pain in my heel, and he says plantar fasciitis, he's actually said the Latin word of what your condition is. But why? Why has it happened? So as the foot's collapsed in and elongated that arch and torn that fascia, the shin bone has to collapse with the foot. So it has to turn. As the foot collapses in and the shin bone turns with it, it turns at the knee. And that creates wear and tear at the knee eventually. Creates inflammation at the knee. So the inside knee starts to hurt. The kneecap starts to track correctly. The muscles and around the hip, it says, oh, if the foot's collapsing in, let me pulse the opposite way as the foot's collapsing in. So the body tries to counteract the falling of the arch. And then you've got a from the knee down, you got an internal twist, and from the knee up, you got an external twist, which means the knee starts to wear out. But then the ball and socket, the head of the ball is sitting in the wrong position, gradually wearing that joint and becoming osteoarthritic. Now, osteoarthritis is just wear and tear over time. It's not old age. It's not developed because you're old. It's developed because of timing, wear and tear over time.
All right.
Okay, makes sense? Mm-hmm. So then back problem starts to occur because it's affecting the same muscles around the hip area. Mm-hmm. But now people have what they said, one side pain. One side pain, which means they have foot pain on one side, knee pain on one side, hip pain on one side. 50% of the population have a structural short leg, which means they're actually born with one leg shorter from 4 millimeters above. You might think 4 millimeters is not a much difference.
Is it easy to notice that?
Well, if you consider on a chair, which is a 4-legged chair, and there's a 4 millimeter shortness in one of the legs, it'll be rocking and then it'll annoy the hell out of you. So you can imagine over time, you'll do that. I've got a 10 millimeter short leg. So when I was told I got back pain, it's all in my head, and I kept going to chiropractors and physios. I was basically buying their Mercedes and buying their whatever. For 10 years, all it was because I had one leg shorter than the other. And the longer leg of mine was collapsing more into the arch to level up with the short leg.
It's amazing the ripple effect of what one leg or one little pain somewhere in your foot could have on your whole body, and you can hear it goes as far as your back. And so you're wondering that, why is my back having pains? I think now you could identify a root cause. All right, we're still sitting with Dr. Abbie here in studio. It is 23 after 8 in the morning. We will talk about some of the habits that you have that are silently damaging your body. And we'll also get to understand or rather speak to people in different ages and what they could do to ensure their lives are easy and not have random pain here and about. All right, doctor, we're not going anywhere. Thank you for your insights so far, so good. All right, 23 after 8, Sachin Jigar coming through for you in, of course, on the Morning Fix. The music continues. Send in your questions. I know he has the answer, 0758123444. That's on WhatsApp. Good morning. All right, Arijit Singh, Nikita Gandhi coming through with that jam, taking out the 2017 film at 8:30 in the morning. Good morning. It is Tabby on the Morning Fix, and I'm joined by Dr. Abbie Najjarine all the way from Aussie, Sydney. What part of Australia do you come from?
Sydney, the south part.
Yeah?
South part. It's the Southern Shire area, a place called Illawong. But I practice also in the Southern Shire. My main practice is. But I have about 10 clinics all over New South Wales. New South Wales is a state.
Yeah.
So all around the eastern borders of New South Wales.
You know, when we started this conversation off air, you were telling me you are traveling 4 countries in 2 weeks?
Yes, at the moment I've had 4 countries in 2 weeks.
So you're teaching, right? And you're treating.
Yes.
And that's your day-to-day.
Yes. I've got a passion in helping people around the world, passing my knowledge to everyone, to many doctors around the world. I have been doing it for 26 years, lecturing around the world. It started off in Taiwan, and I was the first group of people I was teaching was orthopedic surgeons.
Yeah.
And if you orthopedic surgeons and podiatrists in Australia are like in competition at the moment, so for me to stand in front of at the time, 35 to 40 orthopedic surgeons was a bit of a shock to me. But then they said to me to be quiet, bring in the patients with the conditions and treat them and show us what you can do. And I blew them apparently out of the water, with all these complicated cases. And it actually changed their minds. And then I realized that orthopedic surgeons in Taiwan were doing 30 operations a day.
30 operations.
Yeah, and they just couldn't cope. And they said, we want something conservative. We want something to treat without surgery because surgery's not working. You know what I mean?
And it's so funny because many doctors, even here in Kenya, will always recommend surgery.
Yeah. So if I was trained as a surgeon, that's all I think, surgery. I'm trained as a podiatrist. I specialize only in biomechanics. My special interest is only in biomechanics. And that's studying of the body engineering, how the body works, from the foundation all the way up. When I went to China a few weeks ago, I had a dentist in my group, and it doesn't surprise me anymore because they are understanding that the jaw out of alignment could be to do with a short leg. So they will show me X-rays of the atlas and axis, which is the vertebral spine of the neck, and they'll show me that how they're out of alignment, and they can see how the jaw is out of alignment and jamming due to the short leg. And that's now becoming a bit more awareness. But in China, they are becoming more aware. You know what I mean? And when I went to Italy, they bring me this patient in that wasn't able to walk. She's actually, I showed the video of it, and she wasn't able to walk. She's literally, they're confused on what to do for her. And I just looked at her and I went, this is biomechanical. She's got a short leg, and I had to manipulate the joint back in. That's part of my job also, to align the joints back into position. The foot, knee, hip alignment back into position. Within 5 to 10 minutes, she was literally walking. You know what I mean? That opened up a lot more lecturing circuit around the world, because people were like, what the hell?
Yeah, what did you know?
What the hell? We were giving her Medicaid, and the doctor kept saying, this is a pain management problem. That's what he's telling all of us. All of us. I kept saying, no, it's not pain management problem. Pain management problem is more medication, more injections, more surgical intervention. No. We need to work out how to stop the medication, how to stop inflammation, treat the cause of the problem rather than just treating the symptom.
And that's exactly what Dr. Abbie's job is. You've heard it. He's had 26 years in the industry, treating this, teaching this. Listen, so Doctor, most of us are sitting in all day, the offices, standing in heels, walking in some questionable shoes as well. What are some of the everyday habits that you see that you would say are silently damaging people's bodies? Because, you've seen it for over 26 years.
Well, I've been practicing for 36 years, but lecturing for 26 years. And what surprises me, it's funny because my wife's a lawyer, and she used to wear heels. And I used to say, stop wearing them. It's embarrassing. I'm a specialist. I do podiatry. I look at mechanics and people, you embarrass me. She goes, but I feel confident in that shoe. And I had to change my concept on that, because I'm thinking, well, some people work in the industry that need to wear heels. I had to make something to align them even though I don't agree with them, I really don't, because I know it's damaging for the feet. Okay? But if you're sitting around behind a desk, it's fine. But if you're walking a lot in high heels, or it is not good.
Yeah.
It's going to cause you. And people think bunions are created by high heel shoes or pointy shoes. It's not.
No.
It's genetic.
It's genetic.
Mechanically genetic. The first bone is shorter. And it develops. So you might get a child coming and say, with the mother, and the mother will say, my child's developing the same as me. Bunions. It is genetic. The bones are genetically designed the same way. Not all the heels do is make it worse. Might cause clawing of the toes, might throw the pelvis into what they call an entropelvic tilt, which means a sway back forms, increases stress on your lower back. Yes, it's damaging. You know what I mean? But I've worked with a lot of high-level athletes and ballerinas. You can't tell these sport people, don't do that, it's not good for you.
Because it's their art, and they do it really well.
And that's their money sometimes. That's how they make their money. So we have to work around that. We have to work and say, okay, we're looking after the ballerinas. They're going to, of course, ballet will damage their feet. They're going to end up with clawed toes. They're going to end up with severe problems. But that's their art. That's what they have to do. So I have to accommodate something for them. Train them how to exercise, train them how to correct their feet alignment to avoid issues later on. If we're seeing a lot of professional players, if I'm seeing a soccer player, and I'll say to the coach, he can't be on that field, that position of the field. Has to be playing wing because his legs are similar to mine, pigeon-toed and out-toed, and he can only play on that side because he won't damage his knee. If he plays on the other side, he'll damage his knee. So I need to look at the cause of the problem. Shoes like Skechers. People, I'll be honest with you, I'm seeing a lot of people in Africa and in Kenya are wearing Skechers.
They are comfortable.
They're the most damaging for the feet. They're no support. They're comfortable because they're cushioned. But are they doing anything? No, they just actually accommodate the wrong position of your foot and allow your foot to collapse further in. Any shoes that have too much cushioning is unstable for the body. The foot move in and out. The shoe should have a strong heel counter, the strong back of the support, The base of the shoe should not be like a sponge. It should be firm. As you hit the ground on the outside, it lands on the outside. As you come forward, then it comes to the mid stance and then toe off. That toeing off position, you don't want the foot to collapse in because then everything, the upper chain will start to follow through. You know, your knees will start to turn in, your pelvis will start to throw out.
Goes all the way to the back.
So you need that control. So I created an orthotic device that is now sold at the Lions Hospital. It is called Crown Medical Orthotics. It's heat molded and it's designed to change the ground to suit your foot position. But it has to work along with an assessment. You can't say, here's an orthotic, see you later. You have to actually work with the body. Okay, let me explain this. When you got water going through a hose and the hose has multiple kinks in it, the water can't get through until you undo each kink in that hose, to allow the flow of water to go through. If I'm changing the ground to suit you, there's a flow of correction going through the system. If there's a tightness in a certain muscle, that's the kink. If something out of alignment, that's the kink. You have to undo the kinks to allow the flow to go. So combination of manual therapy and orthotic therapy has to work together.
Okay.
And that's what I've been training the doctors to do. Stop just prescribing orthotics. Stop just giving exercises. Stop giving medications. Combine it all together. Combine the treatments together to get the best holistic result for the patient.
A wholesome treatment.
Yeah.
Okay.
So I also do injection therapy like chlorotherapy, which is a glucose injection that converts to collagen formation to allow the joint to repair itself. But I won't give the injection unless the alignment is corrected.
True.
You know what I mean?
Yeah.
So I would align it first, and then I'll inject to help repair the joint alignment, the surfaces. But the foot has to be aligned first, like any engineering structure. So biomechanics is studying the engineering of the body.
Okay. There you have it. Then you know some of the habits that you're into and what they're doing to your body generally. You've had it from Dr. Abbie. Doctor, for someone who wakes up with stiffness, or ends the day with some sort of like body pain, what are the early warning signs that this is something serious and not just normal exhaustion?
There's no normal exhaustion. I have energy when my feet are aligned. I don't overuse the muscles anymore. I'm actually using the right effective muscles with my body. It's like when you walk in the shopping center. Some people walk in shopping, they just want to sit down because they can't cope after an hour walking on hard ground. They need to find a place to sit. If your foot is aligned, you find you're able to walk a lot better. The stiffness is a tip of the iceberg. Something is mechanically wrong with your legs alignment. Something's wrong. Stiffness, osteoarthritic formation, knee replacements, hip replacements are signs of wear and tear over time. So people say to me, I might see a child, and they say to me, oh, but he has no pain. Why do you want to fix him? He's pigeon-toed. Yeah, but he's got no pain. Okay, so we'll wait until the pain sets up and he ends up with a knee replacement in the future, then do something about it. No, these are signs that this will be a problem later on mechanically. You know, if we see a tire in the car wearing on one side, we know there's something mechanically wrong in the car, that's why the tire is wearing on the outside or the inside. So we need to fix up the mechanics of the tire. You have to get a wheel balance or wheel alignment. You know what I mean?
And it's so interesting because you're able to spot it with anyone, you know, because you're able to spot it with me even when we did an assessment idea.
Yeah, I can just look at somebody.
Yeah.
I've trained my patients. You know, they say one happy patient will tell 5. One unhappy patient will tell 10. My patients are my word of mouth. My patients are the referring base in Australia. When you say, what is mainly your referrals in Australia? Well, most of them, my patients, 85 to 90% are word of mouth. Word of mouth. I got people flying in from overseas. I just had a lady from Belgium fly in to Sydney before I came out. And she said, she's a international basketballer. And she said to me, I've got nobody doing what you're doing. So I had to come out to you. And I said, what about the video I sent you to show the physios and the doctors? They had no idea what you were doing. So it is, I want the knowledge out there. I want doctors to follow the system to prevent people from having surgical intervention. You can avoid stopping people from having knee surgery or hip surgery. I remember working with a surgeon in the operative theatre. He opened the knee up and closed the back up. And I said, I won't mention his name, but I said, doctor, what are you doing? I was assisting at the time. That was back in 93. Yes, as well. They're going to be in healing process for another 6 months, rehabilitation, and we'll deal with it in about a year down the track. I said, but he goes, I couldn't find anything wrong. That shocked me. And he said to me, 60% of knees I open up don't even need the surgery. I said, what are you doing? He goes, I'm a surgeon. And that shocked me. That upset me. That really upset me. And I thought, no, that was back in 93. I said, no, I need to change this. I need to get people to be aware, doctors to be aware, there are ways of fixing things without surgical intervention.
There you have it. Dr. Abbie has been recommended by many, and he is here in studio. I'm going to get to your questions in a bit. Before we wind up right now is Vishal Dadlani. Good morning.
This is Radio 44.
Okay, 7 minutes to 8, or rather to 9 in the morning, and we're still here with Dr. Abbie talking about how to best take care of our bodies. He is very much experienced, and people talk about his expertise for over 26 years, so you can be sure that he is to be trusted 100%. Let's talk about childcare. How do we protect children from long-term pain? And how do we notice these issues when they're younger and maybe even sort them early?
Yeah. Children are the best time to correct. They're like a tree growing. If you see a tree leaning over, we all rush to the tree to correct the alignment of the tree while it's growing, and we protect it and nurture it in a way to make sure that tree has a sound foundation and a structural foundation control, and then as it grows, it becomes matured, you can take the stake away. A child, when you see a child has knock-kneed, pigeon-toed, severely out-toed, are delayed walkers. When I say delayed walkers, if they haven't walked by 15 months, something mechanically alignment is not right. Something not right in mechanics. You have to look at the feet, the knees, the hips.
And is that something to be blamed to the parent, or is it just a body development thing?
It is something sometimes. So what happens since day one, from humans came on Earth, I believe in Adam and Eve. So from day when Adam and Eve came along, they were perfect specimens. But over time, things have changed, and environments have changed, and we have mixed with different people when we marry, and with different partners. Eventually, over to all this time now, we have actually created some what they call mechanical problems, which means the bone might be torsion, twisted in. The bone might be twisted out. It could be the womb positioning, how we would position the womb. We might have what they call a club foot, or we might have had some other issues there. So these things are genetic. Some of them are genetic. And then things can be corrected while the child is growing, but you need the right person to correct them. So a lot of doctors like myself, who was growing up, there are mechanical issues. I picked up from one leg from my mother, which is pigeon-toed, and one leg from my father, which is out-toed. I was in-toed and out-toed. Where my sister picked up my father's out-toed position, my brother picked up my mum's position, which is pigeon-toed. These create knee problems as you get older. So when you're playing sport as a child and your knees starting to hurt, it's not the sport. It's actually something wrong mechanically in your legs that need to be rectified. So under the age of 18 and the younger you are, we can actually correct the mechanics of the foot while you are growing. Like a tree growing, you plant it and straightening it up. You can actually straighten the child's foot position, change the ground to suit the foot position, align the bone and correct the torsion, but it has to be a trained biomechanist. It can't be just any doctor can do that. A lot of them don't know what I'm talking about. Most doctors, when I first train them, they have no idea. After that, they get a shock that things can be corrected. And I showed them videos of how can be corrected over time. But you need to follow the child through to adults. It's like exactly like having braces on teeth. Braces on teeth straightens up our teeth. Orthotic therapy, using gait plates with orthotics, straightens up our alignment as a child is growing. There's no difference between braces and orthotics.
Okay. All right. I appreciate that, doctor. I want you to speak to the 25-year-old listening, the 40-year-old listening, the 60-year-old listening, and they're thinking maybe they suffer stiff necks more often than not. They have this pain here and there. Or perhaps they even want to know how to take care of their bodies better from your perspective. Please speak to them before we wrap up.
Let's start with a 25 years old, for example. They go to the gym. They do everything normal, but they're having this recurrent hip pain or back pain or knee pain, say. These are little signs that you'll end up with a knee replacements or hip replacements.
Right.
Something mechanically is not wrong, but they're forcing it for thinking, I'm going to get fitter, I'm going to get fitter. Or they're just walking home from school, from work, or they are wake up in the morning with knee problems or back problems. There are signs something mechanic is wrong. Like an engineering of the body is wrong. Something's needs to be rectified. But if it's left when they get to the age of 45, becomes chronic. Look, I've been with this problem like I heard it yesterday, I've had this problem for 25 years. I had a cruciate injury. I had a meniscus tear when I was 20, but now it's got really bad. Doctor says I've got arthritic changes. I might need a knee replacement, hip replacement. These are signs that with time, things are wearing out without you doing anything. All you're doing is taking painkillers or on and off painkillers. You might be seeing a physio on and off, but the problem is you might be resolving pain for a short while, but then it comes back, which means the cause is not being treated. As I said about the crack in the wall, you can keep fixing up the crack in the wall, but it keeps coming back, but it gets bigger and bigger over time. So it needs to be rectified mechanically. So aligning the foot. Some people see, I wear glasses, and this glass is wedged in a certain way for me to see and read. I can buy glasses off the shelf, but they're not going to do the right thing. I have to go to an optometrist, specializes with eyes, get the right prescription so he can make a lens between my eyes and what I see.
Yes.
I make a medium between the ground and the foot to align the whole posture, the whole alignment. So this is a medium. Similar orthotics and opticals are the same. Those are just a part of the body. But because we walk on hard, unyielding surfaces in our society, our foot's changing to suit the hard ground. I need that medium between the ground and the foot.
Okay. I did see some questions coming in. I did notice questions about neck stiffness. Doctor, for people who are very interested in this conversation and they're wondering, they want this specialized treatment and they want someone like you to speak to about the issues, is it possible? Because I know you're not based in Kenya, so how can they find you, or how can they be able to see someone who you have trained perhaps in the country?
I'm at the Lions Club International at the moment, hospital, and I'm training a few doctors there. I'm training Dr. Shilpa, and I'm training Dr. Ali at the hospital. I have trained others when I was here last November from different parts, but it was initial knowledge first. It was a shock to them, initial knowledge, but they grasped it and they thought, wow, this is amazing. But these two individuals are grasping what I'm doing. They're actually sitting with me yesterday. We saw a lot of patients yesterday, and at the hospital. And there's still chance today, if there's opportunities that can come in. I'm unfortunately flying out tomorrow, but I'll be back in November. They want me to come back in November for more training.
Okay.
So there's opportunity. But I'm trying to teach people in the country to follow the system to get results for patients and to relieve their pains and discomfort.
All right. So you're saying we have people who have been trained here in the country, and we can be able to see them to consult, right?
Yes.
All right. Thank you so much, Dr. Abbie, for being with us here in studio. I have 3 quick fire questions before I let you go. The response is top of your mind. Don't think too hard, yeah? Question number 1. Is the 10,000 steps rule a specific necessity or just a clever marketing ploy?
No, I believe it's important. Our circulate. We need to walk. We need to get the blood moving. We can't be stationary. But 10,000, I would even push it up to 15,000 if I have to.
Okay.
Yeah, but you need to get your feet. Look, a lot of cardiologists refer patients to me saying, we have patients that cannot walk. We need them to walk because their heart and their circulation. Get your feet fixed up if you can't walk. Get your legs aligned first.
Okay. So getting your 10,000 steps, even 15,000 if possible. If you could ban one type of popular footwear forever, what would it be?
Flip-flops.
Those are favorites.
Of course. I've actually made arched flip-flops because there's a demand. Australia is into it all the time. So we call them thongs in Australia. I can't think I can call them thongs.
Wow. Okay. Okay.
In England, I got trouble saying that we make custom-made thongs.
Yeah.
But no, and the Skechers are the second one. I'm not targeting Skechers as a company. I actually think they do make some good shoes. But there's these spongy, foamy Skechers are dangerous for us. Even though they might be comfortable to wear and they feel like they're light, they're actually doing nothing.
All right. So Skechers and flip-flops.
Yes.
Okay. Finally, what is the single most common mistake people make when they're buying shoes?
They're going for fashion. And you know, I've noticed in Kenya there's a lot of diabetics. So bad shoes can cause ulcerations for diabetics, especially if the diabetics are listening. Please don't go for tight wearing shoes. Don't go for fashion. Try to go for something comfortable, supportive, and that helps your foot alignment and helps your back and your knees and everything.
Okay.
You know what I mean?
I appreciate your time, Dr. Abbie. Thank you also for the knowledge you're passing down to our doctors here in Kenya. You said if we want to go for consultation, we can go to Lions Side First Eye Clinic?
Yes.
Eye Hospital? All right. Thank you so much. Your questions have been noted. But listen, there is a doctor you can consult at the Lions Hospital. Please make a visit in case we are able to catch Dr. Abbie in the country still. Thank you for your time.
Thank you
did say
for
you
having me.
enjoy Bon Jovi.
Oh, yes.
Well, here he is. Good morning.